Preparation for crutch walking. Before handling crutches to the patient, it is advisable to make some preparation prior to walking. So what those preparations are? The first is the assessment. We start with the upper extremity, arms. So muscle of the arms must be assessed if necessary. It is usually necessary in case of patients which are bed bound. They are bed for a long time, so their muscles often are weak. In such cases, we need to assess the strength of the muscle, and before the patient start walking, the muscles should be strengthened so that patient can easily transfer weight to the crutches. Now, first of all, extensor and abductors of the shoulder should be assessed, and if they are weak, they should be strengthened. For the elbow joint, extensors should be assessed and strengthened. Hand grip must also be tested because the patient needs sufficient power and mobility to grasp the handpiece. So hand grip muscles strength should be tested, strengthened if there is no sufficient power or strength in those muscles. Result of these assessments will determine the type of crutch our patient needs. Legs. Assessment for non-weight bearing. Mobility and strength of the unaffected leg should be assessed, as weight will be taken by the unaffected leg. We need to pay particular attention to the hip abductors and extensors, knee extensors, and ankle plantar flexors. These muscles must be sufficiently strong to take weight of the whole body. For partial weight bearing, mobility and strength of both the legs should be assessed, as weight is being taken by both the extremities and the muscle must be strengthened where it is necessary. Third point is balance. Sitting and standing balance of the patient must be tested, and if required, patient must be trained prior to walking. Crutch walking. Whenever physical therapists plan to stand and walk for the first time, he should have an assistant with him. Therapists must instruct the assistant on how to support the patient to an upright position and how to transfer the patient to the crutches prior to the crutch walking. Now, in case of non-weight bearing gait, non-weight bearing gait, also known as 3-point gait. Now, in this type of gait, 3 points of support contacts the floor. As you can see here, there are 3 points of contacts on the floor. 2 are the ends of the crutches and 1 is the unaffected extremity. Here also, as you can see. Now, patient should always stand in a triangular base, as you can see. Here the base is triangular. Now the crutches either in front or behind the weight bearing extremity. Here the extremity is in front, crutches are behind the extremity, and here crutches are in front of the extremity. 3-point gait pattern. 3 points of support contact the floor, as you can see here in the image. This is the starting position. These 2 points represents the end of the crutches, and this is the unaffected side. This 3-point gait pattern is used when the non-weight bearing status is required on the lower extremity. So here the affected extremity will not take weight, so this pattern is also known as non-weight bearing pattern. Now to walk, patient first move both the crutches a little forward, then take weight down through the crutches and lift the foot forward. As here you can see in the image, patient is lifting his foot forward and then position the foot in such a way that it should be a little behind the line of the crutches. Here we have the ends of the crutches, so we can draw an imaginary line and the foot should be placed just behind the line of the crutches. Now in case of progression, what we can do, we can lift the foot forward to a position just in front of the line of the crutches. Now foot will be moved in front of the line of the crutches when we made progression. So this gait pattern, also known as shadow walking. Why shadow walking? Because the affected extremity or the affected leg is moved in sequence, simulating the walking but taking no weight. Partial weight bearing. This pattern of walking, also known as modified 3-point gait pattern. Here the crutches and the affected leg are taken forward and put down together. So let's see here in the diagram. This is the starting position. Now this is the affected extremity and this is the unaffected extremity. So both the crutches and the affected leg or the extremity are taken forward and put down together. The 3 are in the same line. So the weight is taken through the crutches and the unaffected extremity, while the unaffected leg is then brought through. As you can see here. Now again the pattern is repeated. Both the crutches and the affected extremity are put forward together and then the unaffected leg is brought through. 4-point gait pattern. This method simulates normal walking and more weight is taken through the affected leg compared to the 3-point gait pattern or the modified 3-point gait pattern. Now here, the weight is borne on both the lower extremities. Typically, this pattern is used with the bilateral involvement, like in patients with the poor balance, incoordination, muscle weakness, when the problem is in both the extremities, like balance is poor in both the extremities, incoordination in both the lower extremities, and weakness also in both the extremities. So in such condition, this 4-point gait pattern is usually used. So here, this is the starting position. First, the right crutch will move forward, followed by the left extremity. Then the left crutch will move forward, followed by the right extremity. Next comes the 2-point gait pattern. This gait pattern is similar to the 4-point gait pattern. However, there is a little difference. It is less stable when it compared to the 4-point gait pattern, because here at a time only 2 points of floor contacts are maintained. Therefore, use of this gait requires better balance. So this pattern is usually prescribed to the patients who need progression after 4-point gait pattern. Here is the starting position similar to the 4-point gait pattern. These dots represents both the ends of the crutches. Right crutch and the left leg are moved forward, followed by the left crutch and the right leg. So here, instead of 4 points making the contact, only 2 points at a time are making contact to the floor. This 2-point pattern is more closely simulates normal walk or the normal gait pattern, as much as the opposite lower extremity and upper extremity move together as we see in the normal walking.